Happy Friday, guys. Welcome to another health talk with Victoria. All right, so let's do some quick housekeeping, making sure this everything is working well because we have a change with a setting this Friday. So, okay. Welcome. So let me do a quick check and make sure that audio is working. All right, I think audio is working. Yeah. Okay, audio is good. Awesome. All right, thank you to God be the glory. Hallelujah. Happy Friday. Such a good Friday today. Yes, and it is a good Friday. So welcome to Health Talk with Nurse Vickie. I do this every Friday if my schedule permits. I know last week Friday I wasn't able to come up live, but I'm back here. So the plan is to do this every Friday as long as the schedule permits. But sometimes it doesn't, and if it doesn't, we'll make it up another time. So, welcome. If this is your first time, my name is Victoria Showme. I'm a registered nurse and I've been in the space of healthcare for over 16 years. And I'm glad to be able to do this, just bringing some health talk, some things that affect our lives, whether you are a male, you are a female, things that can help us to stay healthy and can help us to be here for the long haul, by the grace of God. So thank you. Please don't mind to say hello to me. Let me know where you are watching from. If you are on YouTube, if you are on Facebook, if you are on LinkedIn, let me know where you are joining me from. And please feel free to share this to somebody. Invite somebody. Let us come in together and let us really, get some tips that we help you, probably can help you or help somebody else in your life. The last time I was here, that was about 2 weeks ago. We kind of talk about some symptoms of chest pain. We talk about chest pain as it relates to a heartburn and as it relates to a heart attack. Yeah, because it's a common symptoms for both. It can pain can be as a result of a heart attack if somebody is having that episode or somebody is having a heartburn. So we went detail into it to kind of be able to tell the difference and what you need to do if you are experiencing such. If you are experiencing things like that, what you need to do and the implication as well. So, but today I am bringing another topic. Actually, this is a chronic disease that we are going to be talking about today. It is a chronic disease. Yes, it is a chronic disease that we are going to be talking about today. Probably it affects you or you know somebody that is affected right now. And so this information is really going to be very helpful with that. Make sure that everything is good here. Okay, I believe I'm good. If you guys are having issue with me, let me know so I can definitely adjust my setting. But I think we are good. All right, so let me do a little housekeeping here and there, making sure. Hi. Nas Vickie here, Nas Vickie here, Nas Vickie here, Nas Vickie here. Okay. Just checking. All right. Just check. Okay, I think we are good. All right. I just want to make sure that everything is good on my hand here. So thank you for those who are here. Thank you. Just checking, making sure everything is set over here. Thank you, because I kind of get a sign that something is acting up. So I want to quickly make sure we take care of that. Happy Friday, happy Friday, happy Friday, happy Friday. Thank you for being here. God bless you, God bless you. And how are you planning for the weekend? It's such a holy week here, and we thank God for, we thank God for Jesus. Thank God for the life of Jesus. That is why we can celebrate uh, Easter. Okay, all right. So I think I get a go ahead here. All right, as I was saying, welcome again. Yes, my name is Victoria Showme, and every Friday, as my schedule permits, I try to bring in some health talk, discussing some health issue, something that when we know it helps us. Knowledge is always power. And knowing what to do is always key. Sometimes people don't know certain things, and certain things when we don't know, it can really cost life. So when you know certain things, it helps you to make certain judgments. It helps you with your decision making, and it helps you to really know what to do. Because some things, when it comes to health, time matters. When it comes to saving life, time is a very crucial thing. With time, we are very like, okay, when does this start? How long ago? So that really helps with saving life and really kind of minimizing the effect of any health issue or any complication that may arise. So today I'm going to be talking about diabetes. Yes, diabetes. And it is a chronic disease. When people have diabetes, it is chronic disease, something that they have to live with, and they have to manage. Yeah, they have to manage. So we're going to break it down to what is diabetes, diabetes mellitus. I'm going to break it down to what it is. I'm going to talk about three types of diabetes. I'll talk about three types of diabetes, talking about some common symptoms of it, and then some complications of it. If care is not taken, certain things can happen with diabetes if care is not taken. So, if you ever heard of diabetes, let me know. Put one in the chat if you ever heard of the word diabetes, or you actually know somebody that has diabetes. Put one in the chat. Put one in the chat if you ever know somebody or ever heard of the word diabetes. Put it in the chat. That is what we are talking about today. Talking about diabetes. Um, and like I said, this is a chronic disease, and I'm looking at my note here, guys, because I want to make sure I I eat all the point that I want to eat and be able to make sure whatever I'm saying, everything makes sense to you. Not to use any medical jargon, to use a term that you can really understand. Um, so diabetes, it is a chronic disease when people are diagnosed with diabetes. So in our body, in our body here, when you eat food, when you eat, thank God for that. Sometimes you don't need to know all the complexity of how your body works. There are certain things that you need to know. Number one, you know that you need to eat every day to be able to maintain your energy, all the things that you do. And that's so long that you can go without food, but there are certain nutrients that our body absorb when you eat. All the food you're putting in your mouth, the things you're drinking, when it comes in through your mouth, there are some enzymes in your mouth going through down your belly that kind of mix with the food, making it to break it down into what the body can actually process, what the body can actually use. So maybe you eat bread, you eat oats, you eat meat, what all this food that you're eating, the body breaks it down. So when it goes down into your belly, there is a little organ there. It is called a pancreas. It is called pancreas. So this pancreas they produces an hormone that is called insulin. So when you eat food, when you eat carbs, these and everything kind of breaks down. The food that you eat is broken down into what it called glucose in the body. When it enters into your belly, everything becomes glucose. It breaks it down, and glucose is needed for energy. It's something that is needed by our little cells. Our organs are made up of so many cells that makes things work in our body, that makes everything to function very well. And these cells, they use glucose. That is like a source of energy. It's like you have a car, and then your car needs oil, needs gas to operate. So you have to, when the tank is low, then you go to the gas station, you fill the tank, right? So the same thing with our body. When you eat, the food is broken down into glucose, and then there is, a like I said, a an organ in the belly called the pancreas that produces insulin. And so the insulin that it produces help to transport. It's like a mix of transportation, help to actually transport the food, transport the glucose now that is being released into the bloodstream, to take it to the cell where the cell can actually use it. So I hope it's not too complicated as I'm trying to break it down. So the pancreas that produces the insulin is in our belly, and the insulin is like a transporter for the glucose that is broken down after you've eaten. The food you eat is broken down into glucose, and that glucose circulates in your blood system. But the insulin now carries that glucose, because the blood doesn't need the glucose. It is the cells that need the glucose, needs the energy to function. The energy to function. All the things, the muscle cells, your heart cells, every organ has cells. So they are the one that needs the glucose to function, to do the things that they need to do. So the insulin now transports this glucose from the bloodstream into all these cells. So when the insulin, and two things can happen, is either number one, that your body, the pancreas, does not produce enough insulin to be able to transport the glucose into the cell, meaning now that there is now excess of glucose that is traveling in your blood. And when there is excess of that glucose traveling in your body, is something that we call hyperglycemia, meaning that your blood sugar is going to be high. So that means number one is either the pancreas is not producing enough insulin to transport, or that it produces it, but then the body is not making use of the insulin that is produced. And that is why there is what we call type 1 diabetes. Some people call it juvenile because it happens mostly in kids. Um, and then we have the type 2 diabetes. The type 1 mean that your body, the pancreas, is not producing enough insulin. And then type 2, now that's type 1. But type 2, your body is producing it, but the body is not making use of that much of the insulin that is produced in your body. So that is why people with type 1 diabetes, because it's like the pancreas is not producing enough insulin, they are dependent. We call it independent. That are dependent on insulin, insulin dependent diabetes mellitus, IDDM. The body depends on outside insulin now to be able to do that. That is type 1. But in type 2, your body is producing it, but probably it's not enough, or is resistant to that is just resistant to your body. So it's not enough to be able to carry the glucose that is circulating, floating around in your blood to the cells. Meaning that sometimes it's called like insulin resistance. And there you will need supplements, something to really help that. You producing some level of insulin, but not enough, or your body is resistant to it. And then you need additional boost, additional of that hormone to help with the blood to help in transporting the glucose that you need to the cell. So when you are not getting enough of those glucose out of your blood stream into the cells, then there is a high level of blood glucose, blood sugar that is moving around. Thank you, ma'am. NP Alice, great afternoon, ma'am. Thank you for joining. So that means your blood is not, that means the blood now has high level of blood glucose that is circulating in your blood. And that is what we call hyperglycemia, meaning that your blood sugar is high. And there is an extent to which it can be high, And so when it's high, that is when the doctor is able to detect what is going on with your body. They have to do series of testing. When they check your blood sugar, if it's high one time, it doesn't mean that you have diabetes, because there may be other things going on in your body. Maybe you just eat and things like that. But usually they do what we call a fasting blood sugar, meaning that for 8 hours you have not eaten food for 8 hours. Most of the time they do it in the morning, and then they will check the level, blood sugar level. On a normal cases, all right, when you are fasting the 8 hours, your numbers should be below 100. Your blood sugar, if you are fasting, meaning that you just wake up in the morning and you haven't eaten anything, maybe just a sip of water for the past 8 hours, and they stick they check you, it should be less than 100 mg per deciliter. It should be like that. But when it's more than that, you fasting. Now look at it, you're fasting, you have not eaten anything, and the blood sugar, meaning that the glucose in your blood that is moving around for past 8 hours, not entering the cell, is still high. If it's over 100, between 100 and 125, then you have pre-diabetes. And the doctor is not going to just do it because just one time. They will ask you come back again. If you go to your doctor today and they check your numbers and it's that high, they will have to repeat it again, because so many things can be going on in your body. And sometimes if they text you and you've been consistent with diabetes, they will probably tell you things to do, maybe adjust your meal, your food, what to eat. If some other things are going on in your body, they will address it. But if it's constantly high, then you pre-diabetes. And now to be diabetes, that means that fasting blood glucose, that fasting blood sugar is more than 126. So if you are fasting normal blood sugar, and this is not to diagnose you. This is not to diagnose you. It's only a physician, your doctor, that can diagnose you. I'm a registered nurse. I'm not diagnosing you. I'm just giving you things that you should be aware of your body. You should be able to be aware that, okay, are you somebody who is pre-diabetic? And these are the things that you should know. And that is why it is very important that every year, no matter how healthy you are, every year, please do your annual checkup, so that there is a baseline for the doctor to know. Because most of the time they compare your number from the previous time that you were there. So if you were at your doctor last year and you go again this year, they're going to look at the numbers and be like, oh, okay, you are still okay, or is it going up? And if it's going up, they could begin to ask you questions and kind of try to find out what can be going on. Why are your numbers going up? So normal is, if you are fasting, it should be less than 100 when you check. Pre-diabetes is when the number is above 100 now, but it's not high enough to say it is diabetes. So it's between 100, that blood sugar when you test it is between 100 and 125. That is pre-diabetes. And if it's constantly above that number, constantly above 126, and you fasting, you have not eaten in 8 hours, and your blood sugar is above 126, towards diabetes. So we've talked about type 1 diabetes. Type 1 diabetes is when your pancreas cannot produce the insulin that is needed. You are insulin dependent, and that is common among children, but even adults can have it. But it's pretty much common in young children because it's like a dysfunction of the pancreas that's supposed to produce that hormone, that insulin, that kind of transports this glucose out of your bloodstream into the cells. But type 2 diabetes is Your body is producing it, but not enough, or your body is resistant to it. So that is when you have type 2. And then based on that, the doctor will look at what is going on to be able to know which treatment plan to put you on. Maybe you can just take oral medications, or you might need to take insulin, as people like type 1. Type 1 people, they're always on insulin because their body is not producing that. But type 2, your body is producing it, but not enough, or your body is resistant to the insulin that is being produced in your that your body produces, and it's not enough. And type 3, that takes me to type 3. Then I'm going to talk about some of the signs and symptoms of it that you should be aware of. Type 3 is what we call gestational diabetes, type 1, type 2, and then we have gestational diabetes. And gestational diabetes, this is only common in pregnant women. If you hear the word gestation, that is pregnancy. That is common when people are pregnant. And it's not all pregnancy that have gestational diabetes. There's some risk factor to it. If you are pregnant and you are above 45, there is a risk for having a gestational diabetes. If you have if you are obese, if you are obese, yes, there are chances that you might have gestational diabetes. According to studies, 8 out of 100 women, out of 100 pregnant women, have gestational diabetes. So it's not common. But the thing is, with gestational diabetes, you only have it when you are pregnant. After you give birth to your baby, most of the time your blood glucose go back to normal. But later on in life, it is a risk for having real diabetes. If you have gestational diabetes while you're pregnant, then there is a risk down the road that you might actually have true diabetes. Oh, thank you. Thank you. Thank you, Nurse Alice. Thank you, ma'am. I'm always inspired and encouraged by you. Thank you so much. Thank you. And I know I need to bring you on my podcast. One of these days, I'll be reaching out to you. Thank you, ma'am. So, type 1, type 2, and gestational diabetes only common in people who are pregnant, not all pregnant women. And your doctor will screen you for that, because there are other things they look at. And if you are, then they put you on a treatment. But most of the time, once that pregnant woman give birth to a baby, then the blood sugar becomes normal. But later on in life, like I said, it may be a risk factor for actually getting diabetes. All right. So, what are some of the signs and symptoms that that you can see when somebody have diabetes, that type 1, that type 2, even type 3? Gestational. Number one is frequent urination. You keep going to the bathroom like every 30 minutes, every hour, you keep going to the bathroom. And it's, sometimes when you drink enough water, I mean, your body, right? When you drink water, you drinking, you go to the bathroom. But when it's like, this isn't, I didn't drink this much water that is making me go to the bathroom this often, that should be a concern for you. Excessive thirst. You are thirsty like 15 minutes, you're thirsty again. Excessive thirsty, excessive hunger. And that means like your cell, we talk about blood glucose, right? The glucose, it is your cells, the cells of the body that needs the glucose. So the insulin helps to transport this to the cells. So if these cells are not getting the glucose, like you as a person, if you are not getting the energy you need, then you cannot function. So when the cells are not getting the glucose, the energy that they need, when they're not getting it, then they're hunger. They're like, I need something. And what you're doing, you're just feeding and trying to eat, to be like, okay, I feel hunger, I feel thirsty. But it's because the blood glucose is just circulating in your bloodstream. The cells are actually not uptaking them to be able to use it. So excessive thirst, excessive hunger, you are weak, you are tired, you are fatigued, and everything, just look at the cell that they are starving. That is it. That they are starving. They have no energy. When you don't have energy, you are just like worn out. You just really like the energy is not there. You are exhausted. You feel tired. You feel so weak, and it can progresses. Somebody having a blood vision. It's like, oh, your vision is not cleared anymore. It's like, oh, I can see that very well. So many things. Or you begin to feel that your nails, your toenails, they're kind of feeling numb, or they are tingling. Like, and usually when somebody have diabetes, we are very concerned with that numbness and the tingling of the extremities, because when they can't feel things again, when they have any sore, then it doesn't get healed that faster. So those are just some few signs. All right, these are not to diagnose you, but just to kind of let you be pay attention to what can be going on in your body. And when you noticing any of these signs, then you might need to check with your doctor. Okay, doctor, I'm eating as much as I can eat, but then I'm feeling that I need to eat more. Then we say, come in, let's do some. No, doctors, they are so great at what they do. They will first check, run those labs, run your numbers to be able to see what is going on. And these people too, when they have any open sores, it's not healing. You have open sore maybe in your gum, in your mouth, and you think like this, it didn't take long for this thing to be healed, but there is not healing. That may be something you want to be like, I need to see a doctor for. So the thing is, number one, understand your body. And whenever you notice any change, please make sure you see the doctor. Sometimes, in my community, I tell people, don't because sometimes my African people, they listen to other African people, and somebody say, oh, when this happened to me, this is what I do and it works. But I say, you don't know the peculiarity of that person. You don't know what is going on in their body. So you taking what they take is not good for you. Please go to the doctor, let the doctor run your numbers, let them check you as a person, and then find out what is going on with your body and be able to tell you what to do with your body. Your body is different from your friends, your other people. Is so different, and other things may be going on in their body that are not going on in your body. So make sure when you are taking you're taking advice from people, or you want to take somebody's medication, that you think of that you don't have the same body composition, and others may have like underlying causes, underlying things that are going on in their body that you may not be well aware of. So when you notice anything in your body, you need to let your doctor know. And like I said, they will run some basic lab in 2-3 days. Not even some doctor's offices, you may be able to get your result the same day. But if not, in few days, they will let you know, oh, this is what is going on. And if you've gone to the doctor, they run your numbers, and maybe they're not calling you, you can call them and ask, oh, what are my numbers? And they will let you know. And most of the time this day, thank God for technology. Most of them have what we call my chart, where you can log in after the doctor have seen you, where you can log in. They will give you your username. You create your own password, and you can log in and see your numbers there yourself. But sometimes you can actually call them and they will let you know what is going on. They may tell you. But most of the time, if there's any red flag, the doctor will call you right away. But you want to be an advocacy for yourself. Be your own self-advocate. Call them and ask. We're talking about your health here. We are talking about your life. All right. So I'm talking about some symptoms. Now let's talk about some risk factors for diabetes. There are some risk factors for diabetes. All right. And most of the time, once we know certain things, we can manage some of these risk factors. There are things you can control, and there are things you may not be able to control. So, number one, if you are overweight, then that may predisposes you to diabetes. So and your doctor will let you know that you need to work on your weight to be able to bring that body mass index down. They will let you know. If you know yourself, you know if you are overweight, you know yourself. If in the last 2, 3, 4 years you're gaining 30, 40, 50 pounds, you know yourself. You know that certain clothes don't fit you anymore. And I'm not saying, maybe 5 pounds here and there, but if it's as if you are obese, you know that. Okay, let me not call you out, but if you are overweight, try to, is it due to what you are eating? Are you stressed? All of those things that you can see what you can control to be able to bring your weight to a normal body weight. Number two, is there a family history? Most of the times, these are the ones you cannot control, but you try with the ones that you can manage. If there is a family history, if your parents have diabetes, there are chances you might get it. And one thing that I like here in the United States is that when you go to the doctor, they are going to ask you questions trying to get your family history. And that is to have an idea what things you are at risk for. They will ask you any death in the family, you will tell them. They will ask you what kills them. I mean, if you know. And most of the time, we Africans, from my side of the town, sometimes we just know that people die. We don't know because there is no visit. We don't know how. We just say, oh, maybe the person falls and die or sleeps and doesn't wake. We don't know, but we know people die, right? But here they will ask you, and they will ask you those who die and those who are living, what is their health status? Anyone with a cardiac history, anyone with hypertension, anyone with diabetes, anyone with kidney failure, with kidney issue, they will ask all those questions is so that they can have an idea if you are at risk for any of those diseases. So if your parents have it, if your brother, your sibling has it, then you are at risk for having diabetes. So you may need to ask when you guys come together for family reunion, you come together for Christmas, or maybe this weekend, if you guys are coming together for Easter, you may ask just to help you to know because if it goes round in the family, then it might jump on you. But it's good to have that idea. So family history. If you have high cholesterol, all right, know there are two cholesterol in the body. We have the LDL and the HDL. Or if your triglyceride is high, and those are the numbers that when your doctor do a lab work, they are checking, they will know, and they will let you know if they are high. So if your cholesterol and triglyceride level are high, then you are at risk. And the doctor will actually let you know so that you begin to cut down on certain fat that you are eating. You may need to, instead of using all this oil, you may be using like virgin oil. You may be avoiding some type of butter, some type of food that are highly saturated with fat. And if you have a blood pressure, if you have hypertension, you're at risk. And then some people have it. It's common in African community. And also, all right, if you are above the age of 45, and that is why I tell my people, I say, as you age, there are certain things you need to be aware of, and there are certain things you need to be testing and be checking. By the time you hit 40, whether you are a male or a female, you should be seeing your doctor, because as women, when you are hitting 40, if you have no family history of breast cancer, you start screening for mammogram, right? You start your mammogram screening for that. And when you eat 45 as a male or female, you have to see a GI. They screen you for colon cancer. They do a colonoscopy. So if you're above the age of 45, that's a high risk. That's a risk for having diabetes. So the more you age, the more you are predisposed to certain things. But knowing your numbers will really help you and help you to really manage what you eat, how you eat, and things like that. And I mentioned this earlier on. If you have gestational diabetes, you are at risk for having diabetes. If you have diabetes, your blood sugar was high when you have uh, when you were pregnant, you're giving back to a baby that is over 9 pounds, 10 pounds, you are at risk. And also, all right, look at this ethnicity right now, okay, which I know I am. I fall in this category. uh if you're an African American, okay, so many things are common to us. Blood pressure is common, okay, with hypertension with African American. Here again is diabetes. So we African American, we need to be on top of our health. You need to be active. If you are not active, that is against you. That is like a strike against you. It doesn't matter if you're retired. Try to get exercise in. Try to move your body, move yourself, get your body to work, get to use those glucose that are moving around, get to use them. So if you're an from African descent, if you are Hispanic, if you are Native Americans, you are at risk for diabetes. And most of us, we cannot change that. I'm African American, I cannot change that. I cannot change my ethnicity. That is a blessing for me. But knowing that, that I need to be on top of my health. I need to be checking to make sure I'm good. That is why you cannot play with your doctor. Please, every year. So I know people be like, oh, I'm well. I say, I know you are well. You want to keep that healthy lifestyle, but you need to check with your doctor. Let them run some numbers and you know your baseline, so that when you are off, then you know you are off. But when you don't have a baseline, it's very different. Being in the I work in the emergency room, and when people come in, we'll be asking, give us history, let us know so we can know how to treat you. Let us know your numbers. No, we have people that they always have low blood pressure. We have people, they always have a low heart rate. Their numbers are always low, but they know. And some people, they have high numbers, there's nothing they can do, right? So you must know your numbers, and that's really going to save you a lot of headache down the road. So if you are African American, you have Hispanic descendants, you are Native Americans, you are at risk for diabetes. And if you are someone with history of depression, okay, so some of these diseases, they kind of take people along with them, right? They don't try to walk alone. They try to take some other things with them when they're affecting you. So if you have high blood pressure, you're at risk. If you have depression, you're at risk. If you have a polycystic ovarian syndrome, you are at risk. PCOS, you are at risk. So I was talking about some signs and symptoms to be aware of. Now we're talking about, your risk factors. When was the last time you saw the doctor? When was your blood sugar? When was the last time you tested? What is it? And this you can get over the counter and check yourself. But if you go to the doctor, they will check for you. They will run your numbers. They will run your numbers. And when something is really sticking out to them, they will address that with you. All right. So what happens if your diabetes is not treated? So let me tell you guys, I'm a person of faith and I believe so much in the power of prayer. But at the same time, I believe in knowing what you are praying for and what you are praying about. People are praying, and that is even the Bible says, my people don't get answer to their prayer because they pray amiss. Because people are just praying any kind of prayer, right? And so some people say, I'm healthy. And then Jesus said, I know you are healthy, but you still need to check with the doctor. Yeah, some complications of a diabetes, if it's not treated, or if it's not well managed, it can lead to blindness. It can lead to blindness. We talked earlier on about one of the signs. One of the signs and symptoms is blurred vision. The vision is not as sharp anymore. It's blurry. You can't see so clearly. If it's left untreated, if you have diabetes and it's left untreated or not managed well, it can lead to blindness. It can lead to blindness. I mean, may we not get there, but I have seen people, okay, being practicing medicine, nursing for quite some years. We have seen it. It leads to people having what we call amputation. Earlier I talked about when your cells are not getting, it's like your cells are not getting all this glucose, they are starving, right? You are feeling tingling of your fingers, of your toes, you are feeling something, or you are feeling some numbness, it can progress to the point that where you don't even feel it anymore. And we are always concerned. I remember when I was doing a visiting nurse, when I go to see my patient that are diabetes, I will look at their feet. In between those toenails, I will look in there, because most of the time these people, they don't feel the sensation are gone. So like, when you want to take something on the hot stove and it's hot, a hot pot, people with diabetes, if it's not well managed, they lose sensation, and they won't feel it when they touch something that is so hot. They don't feel it. Some, even their feet, they don't feel it. They can step on something hard. They can step on a nail, something, and they will not feel the pain because it's so numb. Those nerves begin to die. They don't feel anything. And when they begin to die, it's not good. And now if they have any open skin, it doesn't heal. And most of the time, that's what leads to infection, because not their body, it takes them a long time to heal. And most of the time, they lose limbs. We have seen people with amputation due to complicated diabetes. You don't want it to get there. Okay? Nerve damage, I've talked about that. Um, It can lead to kidney disease, so many other things, heart disease. People with diabetes, they are 2 to 4 times having a stroke or a heart attack. 2 times, 2 to 4 times higher risk of having a heart attack. And we talked about that last time, having a heart attack or stroke. So they are predisposed to so many things if it is left untreated, if it is left unmanaged. Heart disease, nerve damage, can lead to diabetic coma, and people can pass. So if you know anyone with diabetes, please run some of these things with them, making sure if you know if you're a caregiver to any of them, making sure you are checking their hands, and checking their feet as well. Are they having any sensation? And check if they have any open wound. Because open wound is going to take a while for their skin to heal. So make sure you are checking everywhere to if there's any open skin, it needs to be addressed right away. If not, it's going to be getting expanded. It's going to be getting expanded, and it can lead to a point where it's not well controlled. So check if you have somebody living with anybody with diabetes, always checking their fingers, check their skin for any bruise, check their feet, and when they need to take shower, make sure you are checking the temperature for them, because they don't know. They may not have that sensation, feeling it that it's too hot, it's too cold. If they're cooking, always tell them you must use something. Don't depend on, oh yes, it's not hot. It might be hot, and it's just that they are not feeling it. All right, so when people have diabetes, right, the doctor will diagnose you. I'm a nurse. I don't diagnose people with, I don't diagnose. I just kind of tell you what you need to do and provide some health, some education on that. Your doctor, based on what you have, the doctor will determine what is the plan for you. Most of the time, they will try to see if they can correct it with meals, with lifestyle modification, with either you adjust what you are eating, be eating low fat, low carbs food. They will try different things, lifestyle modification. If you are somebody who is obese, they will try to make sure you lose some weight. They will look at your cholesterol, your triglycerides. If they are high, they will try to bring them down. No, they will try a couple of things to be able to modify before they finally say, yeah, you have to be taking medications. So if you get to the point that you need to take medication, probably for the rest of your life, you will have to take medication. I sorry to be the bearer of a bad news. If you are taking medication, and say if you are gestational diabetes, which we said, once you have that baby, you will no longer need that insulin anymore. But if you are diabetes type 2, type 1, definitely they are taking insulin because their body is not producing that. But type 2, if your doctor said now you need a medication. It can be oral medications. We have medication that you just take by mouth, maybe twice a day, one in the morning. Metformin, glipizide, Janumet. There are so many medications. Your doctor will look at what is going on with your body. We prescribe medication for you. But once you get to that point that you are taking medication, you are going to need to take medication for the rest of your life. The same thing with people that have hypertension. If you have it, most of the time, pretty much for the rest of your life, you are going to take that medication. And or the doctor might go to say, okay, you need to be using insulin or any other injectables. This day, there's so many other medications out there. This, thank God for this pharmaceutical company. So many injectables that people can take now to help control, manage the diabetes, and some of them do have they do have a benefit of weight loss, because weight have to do with diabetes as well. But it doesn't mean that the fact that you are skinny doesn't mean that you cannot have diabetes. All right. So your doctor will prescribe medication for you, whether oral medications, whether any other injectables or insulin. So insulin, depending on how your body is able to get rid of the excess blood glucose in your body. Right? Does it stay longer? Do you need something right away? So they will prescribe medication. They will prescribe insulin. It can be two insulin depending. I have seen people, usually they put them on two insulin. They put them on what we call a short acting or a rapid acting insulin. That is a medication. It's an insulin that it works right away. And there's some they put them on the what we call how do we call it now? Long acting insulin. And that one, pretty much people take it at night, at bedtime, after you've eaten, because the thing is they try to work with your body and to be able to manage that level of glucose in your body. There are some people at nighttime, by the time they wake up in the morning, their blood sugar will have tanked, like they are probably waking up like with 30 or 40, like they're feeling like, oh my God, I'm passing out. So the doctor will look at your system and be able to prescribe something for you. Most of the time, we have a short acting that you check your blood sugar in the morning before you eat, and then we say take this. Maybe if your number is between this and this, then take this number of units. And then at night time, we say maybe take 20 units, take 30 units. It depends on your numbers, and it depends on the other things that are going on in your body. It is only your doctor that will recommend that. And they may ask you to be seen an endocrinologist, depending. But they are the people who will tell you what you need to do, and you need to comply with those medications. Like we talk about the complications. And so before I wrap up, let me talk about the ABC of managing diabetes. If you have diabetes or you are caring for somebody that have diabetes, it's something we call ABC. And sometimes some people, maybe the doctors put them on medications, right? Oh, be taking metformin, be taking glipizide, be taking whatever it is. These people, they are not taking it. But now all of a sudden they remember, oh, I'm going to my doctor tomorrow. Let me start using my medication today. And then they go to the doctor. So when they go to the doctor, there is a number, we call it the HB A1C. A1, that's the first A1C. So your A1C, it is an average of your blood sugar level the past 3 months. So if you have not been taking your medication for 3 months, and because you are going to see the doctor tomorrow, today you start taking your medications, the doctor is going to know that you have not been compliant with that, because it's going to read the past 3 months, it's going to show them the average. And if your number is high, your doctor is going to be like, what is going on with you? Okay. So that is the A1C, is to check. It's kind of like giving the doctor an idea of the 3 months. And if you have been consistent, if the number is good, that is fine. And if it's not good, it's help the doctor to know that they might need to adjust your medications. They might need, and most of the time they will let you be tracking your numbers, that every morning you have to stick yourself. And these days they have, these days they have insulin pump where you are not even need to inject yourself, and where your body can check your blood sugar for you. And there's so many technology out there. In those days, some people still do it this day, that you have to pinch yourself stick yourself, and then the thing, you put a little blood on that lancet and it reads the number for you. You can still do that. So your doctor will work with you. But you need to be checking every day if you are diabetes, to check when you wake up in the morning before you eat, to kind of know your numbers. Is to help the doctors to make sure whatever medications you are on is working for you. And if they need to modify anything, they can modify that. So that is A1C. It takes the average of the past 3 months. So they see how you're doing the past 3 months. The B is your blood pressure. No, we talk about that, that is a risk factor. If you have high blood pressure, it's a risk factor for diabetes. So you must manage your blood pressure. And if the doctor has put you on a blood pressure medication, you have to consistently be taking it, because you don't want your blood pressures to be that high. So that is the B in A, B, C. A1C is managing, is checking the blood, your give an average, the overview of your blood sugar the last 3 months. That's the A1C. Number 2 is your blood pressure. Your blood pressure must be well controlled, must be normal. So if you have diabetes, you have high blood sugar, you have hypertension, high blood pressure, they are by combination for you. So your blood pressure must be coming down. You must do whatever you need to do to bring that blood pressure down. And your doctor will let you know as well. Thank you for those who are here. Number 3, your cholesterol. We know we talk about that. Cholesterol, if it's high, you are at risk for that. And those are the things that the doctor check. When you cannot check yourself on those things because they are lab work. That is why you need to see your doctor. A1C, B, your blood pressure, and the C is your cholesterol. It must be within normal range. That is why we're talking about if you are obese, to manage obesity. If your cholesterol are high, the doctor will let you know. And sometimes they may have to put you on medication if they are consistently high. They may have to put you on what we call a statins. They put you on medication because those need to be well controlled, because we need it to be here for the long haul. All right, so those are the things that I have for you today on this Good Friday, talking about health talk. Those are the things I have for you. We talked about diabetes today, type 1, type 2, type 3, which I call the gestational diabetes. Only happen if you are pregnant, and 8 in under pregnant women do have that. And when you have it, once you have your baby, that's blood sugar is gone. But you are at risk later on in life to actually having type 2 diabetes. If you are fasting blood sugar must be less than 100. Fasting blood sugar, meaning you have not eaten 8 hours. It should be less than 100. If it's more than 100, if it's between 100 and 125, you are pre-diabetes. Your doctor will let you know if you are that. If they are telling you you're pre-diabetic, that means your number is between that 100 and 125. Your number is there. If your number is above 126 consistently, then you are diabetes. And your doctor, God bless him or her, we work with you on that. We'll let you know what you need to do. You might be able to modify things, but when you are pre-diabetic, they will let you know that you need to make certain life changes, lifestyle changes, so that you don't eat diabetes, because it's high, but you are not high. You are not high enough to be called diabetes. The number is high. Thank you for those who are with me. The numbers are high, but you are not high enough, right, to be called diabetes. So they will tell you this is where you are like right here, and they will want you to do all you can do to bring the numbers down, to make sure that you don't transition into the phase of diabetes. But if for whatever reason you transition into that, they will put you on medications, either oral medications, either insulin, that you will have to now be taking most part for the rest of your life. And we have to be, we thank God for technology, but most people, we have to be sticking their finger every morning, because you need to be checking your blood sugar every day, right? So those are a few things, but please make sure you know your numbers, and make sure you check with your doctor. All right, every year, please do annual checkup. They just kind of they compare your current situation with past year. They look at you, making sure things are still the same. Even God wants us to take care of our body. You want to be responsible for your body. And so many things that can be detected when you go for your annual physical. Some people, they go for the annual physical. That's when they find out that something was wrong with them, right? That's when they find out, oh, this and that. And most of the time, early detection is a key to saving a lot of lives. Whatever the disease might be, early detection is the key. I um I work in a cancer environment, and if we are able to detect something at stage 1, stage 2, is well controlled. But when it gets to stage 3, stage 4, oh, that means he has gone beyond what can be well managed. He has spread his wings to other parts. Now it's not just being in one place, but then he has traveled to other places. Then it makes treatment a little bit challenging, because now they're thinking about the other places that this has been, and trying as much to be able to contain it. But when it does early detection, it's easy. It's easy, it's easy. So please, I'm pleading with you. If you have not gone to the doctor in the last 1 year, please, I know today is probably gone. On Monday, make sure you call and schedule your annual physical. So if you don't have insurance, let me put this out there. If you don't have insurance, there are clinics that take people without insurance. Okay, you might need to pay something out of pocket. And most of the time, they look at your finances. And that is what we determine how much they're going to charge you. Some may be $20 per visit, some may be $35. And some, depending, it may just be free to you. Please, the information are out there. I am in Houston. If you need help, reach out, but make sure. Oh, don't say, oh, I don't have insurance. If you don't have insurance, there are local health clinics that will still see you, and they will still do all these things. They will do the lab for you. They will check the numbers and will let you know where you stand. Even some can even give you medications from the local clinics, or they may give you a prescription to other places to take medications. And most of pharmacies, we always find something that is inexpensive. Walgreens, they have a neighborhood or something, prescription, my neighbor, something like that. Kroger has a very nice program. Some places you'll be able to get a very discounted medication. So please, those should not be an excuse. God bless you in Jesus' name. I wish you a happy Good Friday. Your health matters. And if you have any question, please do not hesitate to reach out to me. So my name is Victoria Showme, and I am the owner, the CEO of Petra Home Care Agency. That is an agency that services Houstonians, the seniors in the Houston area here. And what we do, we help with activities of daily living. We are like the extra hand, extra support for your loved ones. So if you are in Houston and the surrounding areas, or you have somebody, you have a mom, dad, a grandma, a grandpa here in the Houston area, maybe they live by themselves, and you need somebody to be checking on them to make sure they're taking their medications, or you need somebody to make sure they take shower, they get the right meal, or they need companion, we can do that. So please give us a call here at Petra Home Care, 713-320-9619, 713-320-9619. We cover the whole of Houston. We accept a VA benefit. If you have a long-term care insurance, it covers for home care, or you can pay out of pocket. But we will come out and do an assessment, free evaluation, to see if you are somebody that will benefit from home care. The extra help, having somebody to cook for you, having somebody to tidy up the place, having somebody to help with laundry, having somebody to help you with the therapy, having somebody to go out with the doctor with you. I mean, we do a lot of things, and sometimes we're able to take some complicated cases as well. If you have somebody that has a G tube, we can help. Have somebody with a catheter, we can help with colostomy, we can help. We do provide a lot of support for people on hospice, end of life care, so we can support that. if you have anyone on hospice, and sometimes it can be overwhelming for the family. So we are here as a reliever for you. We can provide that relief. So don't hesitate to reach out to us, 713-320-9619. That is Petra Omke. So love you guys. I love you guys till I see you next week. By the grace of God, your health matters, and do everything you can do to stay healthy, and make sure you get up and move your body a little bit. Eat right and sleep well. I love you guys. Have an amazing weekend. That's Vickie. Bye bye.